Hello, Dr. Parks. Welcome. My name is Jennifer, and me and my partner Madison will be talking about the Ebola virus. The purpose of this video is to inform the public of precise measures to take for future Ebola outbreaks. We hope to clearly bring out valid information so the general public will be more than prepared and to inform how healthcare officials and researchers handle past Ebola outbreaks. To start off, the Ebola virus epidemic began in West Africa in 2013 in Guinea and quickly spread to nearby countries by 2014. This led to an uncontrollable spread throughout urban areas. Before this epidemic, the CDC had very limited response to the Ebola epidemic, but as this virus began to spread, the CDC prepared its Emergency Operations Center, or EOC. They also quickly assisted the governments of Guinea, Liberia, and Sierra Leone and gathered a response team. We learned that establishing offices in Guinea, Liberia, and Sierra Leone to help health officials to better prepare for future outbreaks. This brought a better focus on building surveillance by strengthening the public health infrastructure as well as expanding experienced staff in the workforce and improving laboratories. The Ebola virus is transmitted by the blood or bodily fluids and is not airborne. It is important for the general public to not panic if they do travel to Africa or have family members or friends coming from Africa. It is important to note that if you develop high fever, body aches, joint pain, vomiting, or diarrhea, and have traveled to Africa, to call the healthcare officials in order to prepare if by chance you have contracted the Ebola virus. The Ebola virus enters your body through your eyes, nose, mouth, or any breaks, cuts in the skin. To avoid future Ebola outbreaks, it is important to wash your hands with soap and water to avoid spreading it to those areas of your body. Also, isolation would be best to minimize close contact with others if you believe you have contracted the virus and have developed symptoms. This will ensure to avoid any outbreak from spreading to other individuals. During the beginning phase of an epidemic, the pathogenicity of the virus will determine how quickly it is spread. So, in order to stop the spread of a disease, isolate yourself immediately. Make sure to stay hydrated and avoid any alcohol if you have contracted the virus. And of course, you cannot contract the virus by casual contact like hugging. The general outcome of this video is so the public can be better informed on how healthcare officials deal with the health crisis, and as a community can handle an Ebola outbreak in the near future.
Although the outbreaks in Africa have subsided, future outbreaks are inevitable. However, there are steps that can be taken to prevent and lessen the impact of Ebola. To prevent future outbreaks of Ebola, there are several steps the general population can take. One of the biggest steps that can be taken is to control the bushmeat trade industry. Bushmeat is a threat to human health not only because it can spread Ebola, but it is known to cause infections like leprosy, syphilis, influenza, measles, cholera, smallpox, and tuberculosis. To get involved in helping to end the bushmeat trade, getting educated on the bushmeat trade is the best place to get started. Communities are able to contact local representatives to express concerns. Resources can be used to curb the export of bushmeat and come up with alternative forms of proteins in Africa and Asian communities. A step that needs to be taken to prevent the spread of Ebola is developing healthcare systems in other countries. Oftentimes, healthcare structures in other countries do not have patient isolation, proper PPE to protect those treating the patients. This typically also requires outside funding. Another way to prevent future outbreaks of Ebola is to have readily available vaccines for those susceptible of contracting it. There are no currently licensed vaccines to prevent people from contracting Ebola. However, drug trials continue. Anyone can do something to help in these Ebola outbreaks through educating themselves, funding the programs that help to end, or even contacting elected officials to draw their attention to the issues we are facing.